Hi, good evening. My name is Burley Belsa Lawrence. I'm an NP student. I'm here to present a clinical case on Sam Daniels, who is a 17-year-old Caucasian male who presented with sore throat. Sam, otherwise a healthy male, presented to the clinic with sore throat, and he localizes the pain mainly to back of his throat. And the sore throat has been going on for the last 3 days, and he denies any radiation of pain. And he describes this pain as a dull, burning ache, and it's been getting progressively worse from day 2 and now to day 3. And he verbalizes it hurts the most when he swallows either solid or liquid food. And when he consumes cold water, it soothes the pain a little bit. And he's been taking ibuprofen 400 milligrams every 8 hours, and it has helped him with the pain a little bit. And he rates his pain without or before taking ibuprofen as 8 out of 10, and it goes down to around 5 out of 10 after half an hour of taking ibuprofen. The only sick contact that he can remember is that he says his girlfriend had a sore throat and for the last 2 weeks, and he's unsure whether that has been treated or not. Otherwise, his immunizations are up to date and no recent history of travel. Prior to presentation to the clinic, he did notice some lumps on both sides of his neck, and also he was feeling warm for the last 2 days. Sam denies any history of any cough, nasal congestion, a runny nose, or watery eyes, denies any abdominal pain, no rashes that he has observed in the skin, and denies any unintentional weight loss. His past medical history and past surgical history is unremarkable. He's not on any medications other than ibuprofen, which he is taking for his sore throat. And he feels it is helping him. And he has no known allergies. Regarding his sexual history, he is sexually active. He has one sexual partner, and he has been with her for the last 12 months. He takes adequate protection during sexual intercourse in form of condoms. And also he denies any oral or anal sex. Denies consuming alcohol, no smoking, and denies to any illicit drug use. Otherwise, he verbalizes having good family support, and he usually uses up his leisure time playing hockey and hanging around with his friends. He has a family history of diabetes, hypertension, as well as acute coronary syndrome. I did a focused physical examination on him. Like his general appearance seemed unremarkable. He did not have any airway compromise, no stridor, no drooling. He did not have any breathing issues. Circulation was perfect, good color, no circumoral cyanosis. His vital signs, his temperature was 39 degree Celsius. It was a bit on the higher end. His pulse was 110, he was tachycardic. His respirations was 16, and his blood pressure was 120/76. I did a few focused system assessment. The first one I did was SEENT. There was no redness or any eye discharge that I have noticed. Ear was unremarkable, no discharge, tympanic membrane was intact. No nasal discharge, no sinus tenderness or congestion that I could elicit. Throat appeared red with bilateral tonsillar enlargement with exudates. There was palatal petechia present, but no peritonsillar enlargement, no lesions or vesicles in the throat or in the buccal mucosa that I could see. Neck was supple, no neck stiffness, no neck swelling. There was tender, palpable anterior lymph node enlargement that I could palpate, and the size was like 1.5 to 1 centimeter on both the sides. I auscultated the chest. Chest was clear bilaterally. He denied any cough recently. Abdomen, I palpated the abdomen. There was mild tenderness, but on deep palpation, but not overly uncomfortable. And the skin, I did not notice any rashes. So, for this patient, my working differentials would be bacterial tonsillar pharyngitis. That would be my first differential. And most of the symptoms would, especially with the fever, bilateral tonsillar enlargement with exudates, absence of cough, all those fit into this category and lead me to think that might be a possible diagnosis. My second diagnosis would be infectious mononucleosis. The only reason, because I could elicit some tenderness on the abdomen, so that's the reason why. And also, he had tonsillar enlargement with exudates. I could not elicit any posterior cervical lymphadenopathy, which is usually seen with infectious mononucleosis. And my third working differential would be viral pharyngitis. In this case, it would be highly unlikely, given that he doesn't have any associated cold symptoms like cough, runny nose, or nasal congestion, myalgia. So for testing, I would use a rapid strep test and see whether it turns positive or not. And if it is positive, I would treat him with antibiotics because he does suffice the criteria for the center's criteria, and it's greater than 3. And if it turns out to be negative, I would also do a CBC to see whether he has any leukocytosis or any lymphocytosis to differentiate between the viral and the bacterial cause, and also a monospore test. Thank you.